Many thanks for staying here on Joy News today. Away from election-related news, nurses of the Ghana Registered Nurses and Midwives Association are accusing the Ghana Health Service and their regulatory body, the Midwifery Council, of breaching an agreement determining who should pay money before any promotion interview. The association is saying that nurses who are due for promotion are being asked to pay money before they get what is due them, and this is said to be happening in all health facilities across the country. In an interview with Beatrice Edu on News Desk this morning, the Public Relations Officer of the Greater Accra branch of the Ghana Registered Nurses and Midwives Association, Douglas Edufoko, said it is either the Ghana Health Service or whichever facility they are in that is supposed to pay the money for the promotion interview and not the nurses.
You realize that previously when you are promoted, you don't even go for interview. It was automatic. And then authorities said that's fine. There's a need for us to go for interview before you are promoted based on your performance. We agreed. Recently we signed our authorities, our leaders, the Mother Association, the national leaders with the team, and then the
You're talking about the Midwifery Council?
No, I'm talking about the Ghana Registered Nurses and Midwives Association, the national branch, with the team, and then also the fair wages and salaries, and then the Ministry of Health signed what we call the conditions of service, of which when you check the condition of service, Article 13, Clause 1, it talks about the promotion. I'm reading the Clause 2. It states that where interview is required, the promotion of a nurse shall be based on the results of the interview. Where financial obligations are to be incurred as a requirement for the interview, the agency or facility shall be responsible for that. So the question here is, why are they taking the monies? Recently, Ridge Hospital nurses went for this promotional interview and they were asked to pay 100 Ghana cedis, and others pay more than that. Others paid more than that. I went there to seek for clarification and I was nearly insulted by the panel. And
how much has this been going on?
For, let me say, almost 6 months now.
6 months now?
Exactly.
And who exactly is asking you to pay those monies?
In Greater Accra region, the panel, for instance, they presume that if you are due for interview, the facilities, I had a letter, unfortunately I didn't bring it here, so they sent the letters to the various directors of the facilities that if your members are due for promotion, you have to make payments in advance before even the promotional interview date is due. So now they presume that the monies are being paid. But unfortunately, the recent incident that happened, I went there, the regional HR was there himself.
So hold on, clarify this for me. It is the mother body that is asking that any of the branches which has a member ready for promotion should pay to the mother body.
The mother body is not demanding anything from us. We went to sign a condition of service with the government, of which the Ministry of Health is on behalf of the government, and we agreed that any requirement when it comes to financial aspects that would be required for promotion to be taken effect, the facilities or the agency must pay that money. It's a sharp condition. It's not like may. So the fact here is that once this document has been signed, we are expecting our agencies to pay that money. If the facilities are saying they can't pay due to maybe insufficient internal generated fund, we have no issue in that. If they are saying we don't have IGF, then the sacrifice should start from above. They themselves, when they go for meetings or any night duties, they shouldn't collect the lunch allowances or the meeting allowances, so that we know that we are all sacrificing. And here it states that if the facility is not able to pay, the agency, and in this case the agency is the Ghana Health Service, should pay. So we don't understand the reason why the same Ghana Health Service that is conducting the interview is asking us to pay those monies. It's unfair, highly unfair, and demotivating to our nurses and midwives in the country here, especially in Greater Accra region.
Let's stay in the health sector. Authorities of the Achimota Government Hospital are appealing to the general public to assist them reach out to relatives of a 30-year-old woman abandoned at the hospital for more than a week now. According to the hospital administrator, Philip Apetikoto, the woman, who speaks incoherently, mentioned her name as Grace Addo and was brought in by some men who claimed to be neighbors of hers at Achimota. She is unable to state where she lives, neither can she mention names of any of her relatives.
Looking frail and quite confused, 30-year-old Grace Addo was found unconscious more than a week ago and brought to the Achimota Hospital. Following treatment and gaining consciousness, Grace could not answer questions asked by nurses at the ward. She complains of severe pain when she's asked to sit upright. Nurses say she often looks dazed but is able to eat and drink. Esther Baden is one of the nurses.
Grace Addo was admitted here on the 12th of October, and then she's been here for some time now. And since she came without a relative. She came here in the hands of neighbors, and since she's been here, no relative has been here. Okay, initially we wanted a relative to be around so that we can get information, but since the neighbors came in, we asked them to contact the relatives for us. Actually, they told us she's a neighbor. They are all at Achimota. That's what they said. So they are it's a good Samaritan that's brought it. There was one time that a certain man came around, and then he said he's a friend, and he came for the list of drugs that he wanted to help, and that he's trying to contact the sister. And so we gave him some of the drug list, and then there's some that he's supposed to pay. But since then, we've not heard from him.
But the main concern for hospital authorities is the expenditures being made on Grace. Mr. Korto indicated they are unsure of how long they can cater for her because of limited resources. He's therefore appealing to the public who may know her to help them reach out to relatives of this woman.
She was brought here 7 days ago. She was brought semi-conscious by people who claimed they were good Samaritans from her neighborhood. And so our doctor started treating her. She was actually discharged last week, Friday, but she's still on admission. And so as it is now, it is the hospital that is treating, that is again her relative. So we are responsible for everything. But the numbers we got from those people who brought her, when you call the numbers don't go again. And she doesn't seem to know where she comes from or where she resides. But she says that she comes from Swedru, France. But as to where she resides, she's making incoherent speeches. You can't make meaning out of the speech. So we are appealing to the general public, having watched this news item, those who are the relatives should just contact the Achimota Hospital for identification, so that we all put our hands together and treat. Because we have a responsibility as an institution, a hospital, to treat it. The family also has responsibility, as well as their rights under the patient charter. So the unfortunate thing is that we do not have social welfare unit, as other hospitals do have. That's the duty of a social worker who will trace the family contacts and all that. They are trained professionally for that. But this hospital we do not have. And we do have numerous of such patients. Some of them die on our hands. Another issue is that because we do not have mortuary, the onus that then is on us to take the bodies to some other places like Kolebu. So it's a tough one. Right now, her medical bill is about 300 Ghana. But that's not our concern immediately. Our concern is that the relatives will identify her and then pick her up.
Ifwa Evans Chinwi for Joy News.
Really touching one indeed. You're watching Joy News today with me, Benes Abubedu.